Double booking. Double booking is utilized by some offices to fit more patients in when the schedule is full. Two patients will have the same appointment time. For follow-up, in a pediatric practice, a follow-up ear infection check and a suture removal may be scheduled at the same time. Using this system has both an advantage and a disadvantage. Appointments that will only require 5 minutes of the physician's time can be paired with other short appointment. The patient who is ill and needs to be seen will benefit from being worked into the schedule. The disadvantage can be a longer wait time for patients. This can create ill feelings between the patient and the staff or physician. Wave scheduling. Wave scheduling involves having a certain number of patients scheduled for each hour. If 6 patients each require 10 minutes, all 6 can be scheduled between 9 and 10 a.m., or a number of patients can be booked every 30 minutes. The patients sign in as they arrive and are seen in the order in which they arrive. This type of scheduling is also used in certain specialty groups. This system works well in large medical clinic, family practice, and a general practice. An advantage to the system is that when a patient cancels or doesn't show for the appointment, it won't adversely affect the flow of patients. Wave scheduling can also be modified. Modified wave scheduling involves scheduling a specific number of patients in the first half hour, keeping the second part of the hour open for walk-ins, emergencies, or catch-up time. This system provides a method to minimize patient waiting time. It can also result in downtime that is not utilized wisely, depending on the day and the type of patient seen. There are people who arrive early for their appointments or those that arrive later. Wave scheduling can take advantage of this fact. Also, patients who, for medical reasons, cannot be left waiting can be seen within a reasonable length of time without causing much disruption to the existing schedule. Cluster scheduling. Cluster scheduling involves grouping similar types of appointments at the same time of the day. For example, a diabetic patient can be scheduled for the early morning. This would facilitate their having any fasting blood work done. Therefore, the diabetic patient would have to make little or no adjustment in medication and eating. Physical examination can be grouped into certain blocks of time, possibly on one specific day of the week from 8 a.m. to 10 a.m. Cluster scheduling provides more efficient use of equipment or specialized service. This system also allows the staff to anticipate the equipment required. For example, if all flu shots are booked for a specific time period, the need supplies will be ready. Single booking. Single booking is also called a time-specific scheduling. This scheduling procedure is also utilized in specialty and consulting practice. In these instances, a greater time period is needed for an appointment. The appointment may take 45 minutes to an hour. In consulting practice, the physician will need this time to review the patient record and then meet with the patient and discuss treatment options. Physical therapy and occupational therapy often uses the scheduling as it allows time for therapy to be complete along with patient education. Screening patient calls. When the medical office assistant receives a telephone call for an appointment, he/she will have to determine how quickly a patient needs to be seen. This determination is made by asking questions and listening carefully to the answers given by the patient. This process of screening